I'm Dr. Bruce Grandstaff, and this evening we are having a class on the morphogenic field technique, which is a technique that is about 3 years old. We've been practicing it in our clinic for about the last year and a half, and it is by far, in my opinion, the most sophisticated way of having a conversation with the body and finding out what's going on with it. So let me explain what the morphogenic field is. The morphogenic field recognizes that there is energy that surrounds everything in the universe, whether it's an atom or a molecule, or whether it's the earth, or it's people, animals, plant. Everything has a electronic or electromagnetic field, or a torus field, or what's known as a morphogenic field, that can be measured. And the substance can be identified by its energy signature. So when we work with this field, we can find out information that would be very, very subtle and very difficult to find any other way. So basically, through muscle response testing, we're going to bring things into the field and identify whether it's something that the body recognizes or does not recognize. We can measure how big the field is, how small it is, how asymmetrical it is. The object is to have a very large, very symmetrical field. So the first thing we would do is measure the field and find out if it's an asymmetrical field, if it's gone in one area of the body, or whether it's symmetrical and fairly large. The second thing we're going to do, depending on the patient that we see, if they come in with a problem, then we're going to enter the system at the problem. And we're going to, for instance, if somebody says, I've been diagnosed with rheumatoid arthritis. Well, we have the virtual energy of rheumatoid arthritis in here. And so what we would do is bring that energy into the field, and if the patient has that, then it will express interest in it and will stay strong. If they don't have that, the body has no need for it, and they'll go weak. So if they have a condition, say in the lung, we have the virtual energy of lung in this packet here, and we can bring that into the patient's field and see how they respond to it. So if we have lung, we simply bring that energy into the field. If their arm goes weak, it's not an issue. If it stays strong, it is an issue. Now, if the patient shows up with a lung interest, then we know there's a problem there. So is it something the patient has that it doesn't need, like a bacterial energy, a parasite energy, a viral energy, or mold, yeast, fungus, some kind of a immune challenge, or is it some kind of a nutritional deficiency, or is it a toxicity? All of these things have energy, and we simply match that energy against lung, and the body will tell us whether or not it's there. So in the testing that we do this evening, you're going to see that in action. The morphogenic field technique is, as I said, absolutely the most detailed and precise way of finding things that would normally be hidden.